This is Dr. Janowski with Sonata Laser Aesthetics. Today we're going to do a Belotero injection in the tear troughs. The tear trough is the area under the eye where we tend to lose volume and get shadowing and darkness. So it makes the eyes look dark, it makes the eyes look tired, and we want to brighten that area. And a lot of that has to do with just bringing that trough up to flatten it out, and we get an instant brightening. It also happens to be one of the areas where the filler lasts the longest. Usually 2 years is pretty typical, sometimes longer than that. So it's a very effective injection that gives you immediate results and lasts a long time. And I'm going to use a micro cannula to inject it, which makes it very easy. Normally this area has a lot of blood vessels under the eye, so if we go at it with a needle, we're going to get bruising. The technique I'm going to do today virtually avoids bruising entirely because we're going to use a blunt cannula that does not cut through vessels under the skin. We lay the product down very gently and we virtually avoid any bruising. It also hurts less. Most patients say they barely even feel it. So we'll get started in 1 second. Okay, we're going to start the tear trough injection with the micro cannula. This is not sharp and it will just wiggle its way into position here. So, a little bit of a pressure for a quick second here. Sorry. Okay, once we're in, you're not going to feel much. The cannula is in position now, and we're going to just inject a little bit of product. Very gently. Doesn't need very much. Good, okay. So, I just massage it a little bit with my finger. And if you come around to face front, you'll see the difference between the two sides. So we just injected Jessica on one side with the Belotero, and you can see already, I think you can appreciate the difference, a brighter under eye area compared with this shadowy trough on the other side, which we're about to correct. It took me all of about a minute to put it in there, and that's all there is to it. The only tiny little entry point is right here, so she'll probably have absolutely no bruising. And so we'll complete the other side, and then we'll show you the final result on our website. So we just completed both sides, tear troughs, and Jessica already notices the difference, as do we. So just tell us, how was that to get that done?
Very painless and easy.
You hardly felt anything?
I hardly felt anything.
As you can see, she's not going to get any bruising at all, and she has just a little bit of redness, so we just put some ice on it. She's good to go, and that's pretty much all there is to it. This is likely going to last a couple of years. Plus, we have extra Belotero because we almost never use the whole syringe in this area, so now we're going to go and put some in some other parts of her face, so you get more than one zone treated with that same single syringe.
And I'm actually kind of surprised how it went from dark to just being a lot brighter in that area in such a quick shot, and it's honestly was so painless and has made such a difference. There's no concealer under my eye at this point, and it looks like that there is.
Yeah, and she probably won't even need concealer at this point. So that's Belotero for the tear troughs. Great product for a fantastic area.